We're going to start talking about the second part of bleeding as an indicator of disease. So let's move on to hematuria, or blood in the urine. As you can see from this long list, there are a plethora of causes of finding blood in the urine. Some are pretty benign and some are quite serious. Let's start with talking about a urinary tract infection, UTI. This category also has a long list of mild to severe manifestations. For example, pyelonephritis, which is a pretty bad urinary tract infection, gets into the kidney nephrons and causes inflammation of the nephrons. It can get pretty bad at certain times, and it can be acute or chronic. So depending on what we're talking about, it can be either an emergency or long-term kind of infection. Of course, there's also kidney stones / nephrolithiasis, as we've talked about before. Next comes benign prostatic hyperplasia, BPH, where the prostate gland in males, because females don't have one, gets really big. As it grows, it can cause some bleeding in the urine because the ureters pass directly through the prostate gland. Trauma could cause bleeding in the urine, and certainly some medications could cause bleeding in the urine, like aspirin, because it does actually thin out the blood. A known side effect of penicillin is hematuria. Malignancy is talking about cancer, which, depending on where it is, could cause bleeding in the urine. Bladder cancer or something like that comes to mind immediately. Soon, we'll talk about some bleeding disorders that can cause hematuria, such as DIC and hemophilias. Did you know that strenuous exercise can cause bleeding in the urine? At least that's what they say. I've never seen anyone personally who complained of hematuria from overexercising. Last on our list of causes of hematuria is post-streptococcal glomerulonephritis, or PSGN. Once again, this happens when you get strep and you don't get it treated. It's possible that the untreated strep bacteria could go to your nephrons and cause inflammation and damage to your nephrons from protein deposition due to the immune system attacking strep in the kidneys. Now we're back to causing bleeding in the urine. That usually happens a few weeks after you have strep. Anyway, false positives are things that may make you think you have hematuria because your urine is pink or red, but you aren't actually bleeding into the urine. Certain drugs can do that. Common dietary reasons for a false positive, quote, bloody urine include beets, because they're red, rhubarb, and berries. They can turn your urine red and you might think that you're bleeding. A female menstruating can give false positive accidentally because instead of getting a urine sample, you get a little bit of blood in the sample. They say that most of the time, hematuria or bleeding in the urine does not cause pain in and of itself. It really depends on what the problem is. When you start getting into kidney stones, obviously that hurts. Things like pyelonephritis hurt, but it's not necessarily in the urinary tract itself where you're feeling the pain. It's more in the kidneys. As far as testing goes, just about anything works. Urine analysis, if you're looking for some kind of bacteria, or a CT, or an MRI, or even an ultrasound, can usually confirm a reason for hematuria. To look directly at the bladder itself, we can use a cytoscope, which is a little camera that you can run right up the urinary tract and see what's going on in there. You can see that on the next slide. It's just an illustration of a cytoscopy where a doctor is looking at the bladder itself. Hemophilia is a rare genetic bleeding disorder where the blood doesn't clot normally. It can be from a variety of reasons, and we'll look at hemophilia A and hemophilia B as the two that are X-linked recessive inherited, and von Willebrand's, which is autosomal dominant. Because males have only one X chromosome and females have two X chromosomes, males will have any X-linked recessive disease manifest more commonly than females since it's on the X chromosome. We'll talk about this more in class. An important concept about clotting blood is that there's a cascade of events that must happen in order to form the blood clot. Anywhere along the line, if something is missing or defective, the rest of that line will not progress. In hemophilia A, for example, factor 8 is missing in that cascade. The next slide will show the clotting cascade, and I'll talk to you about it more there. Most types of X-linked hemophilia are type A. The other one is the other one. B comes after A, and factor 9 comes after factor 8. Pretty convenient. Another important thing to remember is that hemophiliacs bleed longer, not faster, than other people. When the umbilical cord is cut at birth, an infant with hemophilia will take much longer to stop bleeding. Also, an infant with hemophilia will likely be diagnosed pretty early on because mild irritation causes bruising that is way out of proportion. By the time a child is older, the hemophiliac is used to spontaneous nosebleeds, easy bruising, hematuria, and severe joint pain from blood accumulating in the joint cavities. This is a great illustration of what should happen when a clot forms. Notice that the last part of this drawing on the left ends with platelets and red blood cells being caught up in a mesh because of fibrin. Also, notice in the cascade on the right of the screen that the fibrin doesn't come into play up until the very last part of the common pathway, and that both factor 8 and factor 9 are way up in the cascade in the intrinsic pathway. If the cascade is interrupted before factor 10, which starts the common pathway, then that fibrin clot can't do its job in stopping blood flow. This is the same thing as the last slide, but more simplified. Von Willebrand's hemophilia is the most common inherited bleeding disorder, but it has several subtypes. Von Willebrand's D or VWD type 1 is the most common, and it is inherited through the autosomal dominant pattern. If you remember your genetics, you'll remember that with autosomal dominant genetic diseases, all you need to have is a single copy of the defective gene to manifest the disease. This is not sex-linked, so females are just as likely to get it as males. Notice how common it is. From 1 to 100 to 1 to 1,000 people have this. Do you know anyone who bruises easily and has constant, unprovoked nosebleeds? Mucocutaneous refers to places where mucosa, mucous membranes, transitions to skin. VWD, von Willebrand's disease type 1, has only a mild to moderate decrease in von Willebrand's factor, which illustrates a common pattern in medicine. More common equals less dangerous. VWD is different than hemophilia types A and B in that the problem with von Willebrand's disease is that the platelet can't stick, and there's a secondary deficiency in factor 8. This is a good way to remember the difference between PTT and PT. Notice how the APTT or APTT is in the intrinsic pathway and the PT is in the extrinsic pathway. From what you already know, if someone has hemophilia A, for example, what would you predict this PT to be? The INR is a measurement that involves the PT, so it measures the clotting tendency of the extrinsic pathway. Sometimes it's also called the ProTime or INR, or ProTime INR or PT/INR. The point of it is to get an idea of how bad the bleeding problem is compared to normal people. Let's go ahead and break off right there, and we'll pick up DIC next time.